to see you. I'm Chrissa McFarlane, the founder and CEO of Patientory. And we're essentially a health data wallet that allows users to control their health information and monetize their data. So the biggest problem we're solving today is basically exploitation of healthcare information. So enterprises such as health systems, electronic medical records, data brokers are selling our data and profiting from it. As we see here, almost $300 billion was made in 2021, and we don't make any profit from that information. So today, we don't control that data because it resides in the healthcare hospital system's electronic medical record, right? You have a patient portal, but it's not portable. You can't actually take that with you once you go to a different hospital system or leave that hospital. So with Patientory, we're essentially decentralizing this information and giving that control back to the individual by integrating with health systems across the United States. So we're building the decentralized data for health and medical records, including genomic data, wearable and health devices, as well as your medical records. APIs exist in healthcare today. However, they focus on enterprise B2B transactions, right? And what we're doing is now shifting that control back to you, the individual, so that you can monetize that data for clinical studies or research and development. So where we are today, we've built the largest proprietary blockchain-enabled health information exchange system. It's private permissioned. We're built on, we are a fork of Quorum, and we currently integrate in over 24,000 hospital systems to date, represented 90% of the US data. So this allows users to, when they download the D app, to be able to essentially verify their identity, and our APIs are doing the patient matching with their health information. This also drives value for enterprise organizations such as pharmaceutical companies, health systems, and payers by being able to now create predictive analytics and identify high-risk patients before they come across to their system. So where we are today, we successfully raised a $1.5 million pre-seed round after building out our blockchain network a couple of months ago. And we've gone to market with pharmaceutical companies in recruitment for clinical trials. So we've also received investments from leading healthcare organizations such as Kaiser, Permanente, Moda Health, Novartis, and GlaxoSmithKline. The utility for this blockchain network is helping pharmaceutical companies identify anonymously who these candidates are for clinical trials. So real world use case, we actually started out with Moderna and the COVID-19 vaccine and identifying high potential candidates that were underrepresented in these trials. We're actually part of the first HHS, or Health and Human Services cohort in the Pandemic X that worked directly with the government to help support the COVID-19 vaccine. Since then, we've been recruiting for over 15 pharmaceutical companies using the platform, of course, disrupting the space that is continuing to grow tremendously. As we come off of a global pandemic, we see more and more the need for data and information. So where we are, we have over 190 million records on the data platform. We have over almost 100,000 subscribers to date. We have contracts up to 4 million from our pharmaceutical customers. We're a World Economic Forum technology pioneer. We have a team of 10. It's me and my co-founder. His background is in big data analytics and, built a couple of blockchain. Our advisors are all former CEOs or leaders of former hospitals and payer organizations. We're now raising a 5-seat. We're about 70% committed with a leading healthcare organization as well. So if you'd like to learn more, feel free to contact me at Chrissa@patientory.com.